So you've torn your meniscus in your knee. What now? Do you need surgery? Can you manage it conservatively? I'm Shelley, I'm from Miami Physiotherapy and Lakelands Physiotherapy, and I'm going to answer this question for you today. First of all, let's explain what a meniscus is. So I've got a knee here, a bit of an example. So you'll see in this knee the meniscus is the blue section. So if I bend this knee, I'll hold it forward for you, you can see that it's like two semicircle shaped cartilages, the fibrocartilages that sit there in the knee joint between the femur, the top thigh bone, and then your tibia, the bottom part. Their purpose is to allow this decrease in friction when you're actually moving through the knee joint there, and also to help spread the load of the body on the tibia. So that's its main job. Now there's a couple of ways that you can actually tear a meniscus. It can be a sporting type injury, so something acute and you can tear the tissue in there. Or, and this is quite common as well, you can actually develop these tears just from degeneration within the joint. And that's what we see in a lot of our older patients. Now, of note as well, what we've now been realising, what they've found in studies, is that lots of people develop tears in this meniscus but don't actually have symptoms. So if you've had a scan and it's shown a tear in the meniscus, it doesn't actually mean that that's the problem, and in that case you're not necessarily getting symptoms from this structure. So it's important not to jump to conclusions because you've had a scan. The scans don't correlate well with the actual symptoms. So the next thing to know is there's two very different scenarios that we get with meniscus injuries. So the first one is what we call an obstructive problem with the meniscus. So you've had a tear and there's a section of the meniscus that's broken off and it's in there and it's blocking the joint, or there's a flap that's occurred in there and again it's blocking the joint. So it's actually obstructing the knee joint from actually moving. So the sorts of things that we expect to see in this scenario is locking up, so you just can't physically move the joint, or giving way, so you go to walk on it and it collapses out on you all the time. If those symptoms don't recover, then they are reasons why you may need surgery in your knee. But if you don't have those symptoms, and sometimes we can actually resolve those symptoms as well with physio, then you don't necessarily need to have surgery. So there's a study that's been done and it looked at people who had meniscus tears, not obstructive tears, but they had tears in their meniscus, and they just had physio. And then there was another section of people who had the surgery, the arthroscopy, had the clean out, the debridement. What they found 2 years later, no difference. So the people that just had the physio were just as happy as the people who had had the surgery, so they had a good outcome either way. Of note, the people that had the surgery also had their physio, so it doesn't mean you can't have rehab. But the reason I'm sharing this with you is to explain that in some circumstances, as long as there's nothing blocking the joint, there is no reason to have surgery. You don't have to have surgery for a meniscus tear. You can manage it and have an excellent outcome with physiotherapy. So if you feel that you do have a meniscus tear or there is something wrong with your knee, the first step is come and see one of our amazing physios. We'll be able to take you through a full assessment of your knee joint and work out for you what the issue is and whether we think that we can help you and do some physiotherapy, help you to rehab, and let you know straight away what those options are. So give us a call, we'll pop the numbers down below and we'll see if we can help you out. Bye.